Hello and welcome to Japanese Acupuncture Today, the Hangouts on Air show that brings together experts from the many different styles of Japanese acupuncture. In the coming weeks, we'll be covering a broad range of topics for Japanese acupuncture professionals, teachers and students, and also anyone else who's interested in learning more about our various approaches to healing. Today's show is about scarring and the importance of treating scars in our daily clinical practice. My first exposure to scarring and to treating scars with acupuncture dates back to my student days under Dr. Van Buren in the UK. I first saw him insert 2 needles into either end of a caesarean scar. The insertion was shallow, something I'd never seen before, only about 1 millimeter, and I was amazed to see a color change in the scar within a few minutes. The following week it looked less purple and swollen. Since those early days, the acupuncture treatment of scars has become ever more sophisticated, and today I've invited 4 practitioners of Japanese acupuncture who all treat scars in their own unique ways. So I'm going to introduce my panel. The first of my guests is Paul Movsesian from Australia. Paul has been a pioneer of Japanese acupuncture in Australia. Together with Stephen Birch, Paul created a wave of high-quality Japanese acupuncture teaching, including Manaka and Toyohari style. He helped to set up the Australian branch of the Toyohari Association, and even though he's a highly skilled practitioner, he's a modest bloke, and he still goes regularly to Japan to practice and improve his skills. Paul has developed his own method for treating scars and has taught extensively all over Australia. Hi Paul, good to see you.
How's it going? Hello Oran. Hi, it's doing a bit better, thank you. Thanks for your invitation.
Great. My next guest is Virginia Doran from the US. Virginia has been in holistic health for the longest time. She's also been practicing acupuncture since 1995, studying both with Jeffrey Yuen and many Japanese teachers, including Yuriko Yamagishi, Mikishima, Koei Kuwahara, Kiko Matsumoto, and one of my own teachers, the late Yanagishita Sensei. Virginia has developed and taught her own method of facial rejuvenation acupuncture, teaching all over the world, including Europe, the US, and even Japan. She's currently writing 2 books on facial rejuvenation acupuncture, one for professionals, with a dedicated section on the treatment of scars, and one for the public. Hi, Virginia. I'm really looking forward to hearing your take on everything today. What time is it over there?
It's about 8 p.m. Sunday night.
Oh, okay. My next panelist is Phil Strong from Australia. So back in 1980, as a senior instructor in the Australian Taekwondo Association, Phil started to get into acupuncture. And more formal studies began in 1996. He is specialized in the treatment of scarring through using the 3rd of the 9 classical needles, known as a teishin or blunt needle, and has studied the effects of superficial scars and deeper tissue injuries, including adhesions. Subsequently, he's lectured on his scar rejuvenation technique and has been published in Najon, the bilingual English-Japanese acupuncture journal. Phil, it's a pleasure to have you with us.
Good morning, Warren. How are you?
I'm great, thank you. So, my last guest is Grace Rollins, also from the US. Grace is based near Philadelphia and specializes in Kiko Matsumoto's style of acupuncture. As I think our viewers will know, Kiko is a world-famous pioneer in the West, not only of Japanese acupuncture, but of scar treatments. Grace is a close apprentice to Kiko and has 10 years of experience with her methods. So, welcome everybody, and welcome Grace.
Thanks, Oran.
Through the wonders of the internet, we can now have our very own chat show. So it's great that you could all find the time to come on. So let's get cracking and start talking about scars. What are scars, energetically speaking? And why is there such an emphasis on treating scars in Japanese acupuncture? Paul, would you like to kick off?
Sure, thank you, Oran. Well, we can look at it from the perspective of, well, firstly, it's important to think of the fact that in Western medicine, they don't really have a very good handle or understanding of scars themselves. So even from that perspective, they don't know how to manage scars, and they don't take much notice where they make a scar. But from Eastern perspective, we know that there are not only the primary problems that arise where a scar occurs, but also the secondary effects which occur later, many years later. And why these occur is because the healing hasn't occurred, and adhesions have existed under the tissue. And in simple terms, we can see a scar as chi stagnation or blood stagnation, a blood stasis pattern. And the location of this scar and where and its formation will then determine its secondary effects in how it obstructs the flow of chi.
Thank you. Has anyone got anything to add to that?
Sure.
Grace.
Well, one of the first things that I studied in trying to understand how to treat scars was a 1989 article by Kiko Matsumoto that began with her discussion of her observations of how easily Toyohari teachers could influence the pulse by very superficial insertion of needles or sometimes non-insertion of needles, and that got her to thinking about how, you know, very shallowly ki traverses the body, and so when she began her work of palpating abdomens as diagnosis, it struck her that, well, you know, what are these scars that I'm seeing on everyone's abdomen influencing? Because the abdomen is so important, and you know, some of these scars would be pretty nasty looking, red or keloid, or you know, deep adhesions, and you know, she was convinced, well, treating these scars must be very important because they must be causing some disturbance in the flow of ki in these people's bodies. So you know, from an Eastern medicine point of view, I think that's the best way of talking about scars is how are they disturbing the flow of ki in the body. It's very simple, and from a physiological standpoint as well, we can easily talk about what distortions in the fascia do, because people are starting to talk about acupuncture in that way, like acupuncture as influencing fascia in the body and connecting to organs and connecting throughout the body just through very subtle manipulation of the fascia. And so if there's a twist in the fascia, that's going to be causing ramifications throughout the body.
Thank you. Virginia.
Yes. What are you asking?
Yeah, it's, Virginia, it seemed like you had something to say earlier on when I said, does anyone have anything to add to that? Is there anything you wanted to add to any of that? Or are you okay?
Well, we're going to be primarily talking about treating scars physically, but there's traumas that get stored in the connective tissue and the fascia of the body. Memories and traumas, this is what Rothing is based on, and it's not just deep massage, but also acupuncture can stimulate those traumas to be released from the body. And I think it's very, very effective for that. And so we have to be mindful that somebody might have more than just a physical trauma associated with that scar.
Okay, I've got another question for the panel now. What kind of scars need treating? I mean, are we going to treat every single scar that we find in the body, or are there some scars in particular that need treating? Phil, can I pass that question to you?
Yes, thank you, Oran. I believe that we can look at the earlier scars that could perhaps have been created from, and then subsequent scars occur during life. So these complicate things and add on to the whole disruption of ki in the body. So I think that the earlier scars should be looked at first, because I found a relationship with people with appendectomies tend to have a higher incidence of sciatic problems. So I try to know which side the sciatic is. It's always tends to relate back to the appendectomy scar.
In my own experience, I've noted that if a scar is raised or hot or discolored, or when you palpate that you can feel some kind of presence underneath the scar, then those are often the most commonly the most common signs that a scar needs to be treated. Does anyone have any other observations on the appearance of scars that need to be treated?
Sure.
Yes.
Yeah, you both started together.
Go ahead, Grace.
Well, for me, part of it has to do with what is the patient's chief complaint that they're coming in for, and can I associate a scar with possibly causing a disturbance that can be contributing to their complaint? Because, you know, helping them with what they're asking me to help with is a priority. So, but there are sometimes scars that we'll notice that have such an important effect on the patient's constitution that we'll treat those as well. So, if it seems to be creating a disturbance in a zong or fu organ, or it's on a major meridian like the bladder meridian or the ren or the du, scars on the head a lot of the time will cause big disturbances, or scars on the foot for that matter. So yeah, sometimes we have to take into consideration the location of the scar, as well as the quality of it.
Okay.
And scars are like an iceberg. The scars could be likened to an iceberg or Pandora's box. You don't know what you're going to find, and you know, sometimes a scar it's charged or active or toxic, however you want to describe it in language. So sometimes usually the ones that look red and inflamed are the ones that are the culprit, but sometimes there's old scars that, you know, are kind of sneaky, and they have kind of like a minefield underneath the surface that we don't see.
Okay. So now I'm going to move the question to each of you in turn and find out how do you go about treating scars, and what is your approach? So Virginia, would you like to kick off and tell us what's your approach to treating scars?
Well, I think palpation is the first step, and looking at the scar and what meridians it might be intersecting with, and also, you know, thinking constitutionally before you even get into any local treatment. For instance, if somebody's had a surgical scar for, say, an appendectomy, then you might have to treat some kind of spleen deficiency concurrently or in addition to. So then I would probably try to find a couple of tender spots locally, maybe in the perimeters of the scar, and, you know, probably through successive treatments, or depending how stubborn the scar was, I might eventually needle into the scar itself.
And do you needle into the scar tissue, or do you needle just away from the scar on the borders?
Well, I think I might start in the perimeter, but what I find sometimes with something like wrinkles is if you do that kind of treatment, just coming up to the borders, with wrinkles, it's not enough to fill them up with collagen, and that's part of what we're trying to do with is alter the collagen in the scar tissue and the fibroblasts and all these things. So I think for some scars it's necessary to actually needle into them, but that's not necessarily something you have to start out doing.
Okay.
But, you know, this is something Kiko does. I know there's other people who never needle directly into anything. So, you know, there's definitely different styles, and I'm, you know, looking forward to hearing about other people's approaches as well.
I'm going to pass the question to someone who I think doesn't needle into anything. Phil, you're using a teishin for most of the time. Can you tell me a little bit about your approach to actually treating the scar?
Yes, I use the Yanagishita gold teishin. I've got a very small photo there to demonstrate to about 3.5 inches long, and it's gold plated. I've used solid gold teishins as well, I've found that these scars, whether they're surgical, accidental, or even burn scars from flame or water, does eventually, over time, sometimes more immediate than others, it does create a blockage for that person's constitution. Now, I'm just showing you here a crush injury from a forklift. So you can see a number of toes have been...
Oh, we're not seeing the image.
Oh, I see. Okay, I won't bother.
Okay.
I don't use predominantly the classic, always bring to the millet seed end of the tation, needing to be rubbing the meridian. I found that using the sharper end of the tation, we can get a stronger movement of ki through the tation and into where the area of the scar tissue is. And as we've been saying earlier, there's scars that are discoloured and lumpy, but we also have areas of sogginess and depression there. So particularly my focus for all my research started with this cesarean scar. And we know that with any cesarean that runs horizontally across the abdomen, there's at least 5 meridians affected.
Thanks. Paul, can I ask you to talk about your approach to scars?
Sure. I think there's some aspects that are worth looking at for this. The first is to consider that in the Japanese system in general, even though we're treating something local like a scar, we still have to consider the constitution. So there's always a constitutional treatment that accompanies the scar treatment. The second is to evaluate the scar. And we can use a concept from the blood stasis model, which is a pathological vascular spider versus a physiological vascular spider. We can see that sometimes with scars. Sometimes scars are healthy, are fine. And I like to differentiate between the scar and the scar tissue itself, because often the scar may have the problem, but then underneath, as Virginia was saying, that's where we might find all the problem resides, and then consequently the secondary effects. So to treat that, we'll often use, from Dr. Manaka's work, ideas that he first discovered with treating burns, which was some kind of polarity device to move and change the positive and negative ions on the tissue that then connect to the deeper channel systems, often the extraordinary vessel systems. So we may use, I can put up a demonstration for you here, like of ion pumping cord. Can you, how do you see that? And so that's an ion pumping cord, which is a polarity device. And so with that, we'll often attach something to the site where the inflammation is. It could be foil, a silver chain, a silver ring, a diode ring, and often attach the black clip for inflammatory conditions or pain, or the red clip in numbness, and then use a distal point to try to move that. But he also had many other polarity devices like electrostatic adsorbers, ion beam devices. All of these were very effective. This is an example of an electrostatic adsorber, which tends to take out the charge from the tissue, whereas the ion beam device tends to be able to put in a charge, so you can get that effect much more quickly occurring. Sometimes I might use a press tack and then put the ion beam device over the press tack, putting the charge in at a deeper level to the tissue. So these are some of the ways that we'll work with them. But ultimately, after that's finished, I have always found that I still have to go to the scar and find the last residuals, pressure pain, and with that I often use direct MOXA or some kind of heating pressing device. It could be a thermi warmer or an elephant warmer or some kind of MOXA heat and pressure.
Grace, can you tell us a little bit about your approach?
Sure. My approach is based very much on what Kiko Matsumoto demonstrates. And a hallmark of her style of acupuncture is to use distal points to release symptomatic areas that she finds by way of palpation. So in clinic, what I do when a patient has a scar that I think needs treating is to first palpate that scar for tenderness, or if there's a lot of hardness around the area, feeling of coagulation, and then see if there's a related point or a set of points that might help to release the pain in that scar. And then that'll show me that the key is moving better and that area is going to start to heal because I've made a good selection. And then when needling the distal points, I want to make sure that the needle was inserted properly in the right direction, the right depth to continue that positive influence. In terms of treating scars directly or locally, if a scar is extremely inflamed, the only way that I usually will treat a scar directly is with the Manaka methods that I know by way of Kiko, using ion pumping cords, similar to what Paul spoke of. And I'll use that, the diode rings, chain, Pachi Sparker, or magnets.
Could you say a little bit about what a silver chain is? For those of us who don't know Kiko Matsumoto's kind of equipment, what is the silver chain and how does it work?
Well, I would hand that over to Paul because I believe it's originally by way of Manaka, isn't it?
It is, yes.
Yeah,
oh, okay.
So Paul, why don't you talk about it, because I think you're more of an expert on Manaka.
Oh, thank you. Well, what he did was originally, when he designed his whole program, before he came up with ion pumping cords, he used a silver chain to connect the sterilized tinfoil from a burn to a site where he was distally trying to move the ions. And with time, that got transferred to this copper wiring system that we now have. Later, that chain started to be picked up by Dr. Kawai, an associate of Dr. Manaka, who was part of the Topology Association. And but Dr. Manaka also used to use the chains to, in terms of wrapping around an area. You could encompass an area right around. And then Dr. Kawai further interacted with that and put little diodes spaced within the chain. So the chain was an actual polarity device on its own without even being attached to cords. So it was very clever. I mean, that whole movement was so innovative. The Minus Plus School and the Topology Association, they were amazing at their time of functioning. They don't exist now as a group anymore, unfortunately.
So what would you all recommend for viewers of our show, our practitioners? Should they all be going out and buying this equipment, or should they all be studying how to treat scars?
Studying how to treat scars first, so they would know how to use it if they were going to, but there are certainly ways to treat it without all these devices. Yeah.
So what would be the easiest way for someone who hasn't got any polarity equipment or isn't experienced enough yet to or hasn't done any workshops with one of you people? What would be a good way to start to treat scars? Just superficial needling and MOXA?
Oh, Oran, if I may...
Intradermals?
Yeah, Grace, go ahead.
I think that a tiger warmer is a really great and easy way to start treatment of scars. That is a pretty low risk way. Tiger warmer or lion warmer, I think Philip talked about using that.
Basically, these are MOXA devices, which are used by a lot of people in the Kiko school, which is a piece of incense kept within a metal container, and the metal container becomes like a warm pressing tool to work on the edges or to work on the soft tissue. Is that a good summary?
Yeah, exactly. So you can take a tiger warmer or similar, and I think you could use indirect MOXA or OQ as well. But a tiger warmer, patients usually really like the feel of it, and so it's if they're nervous about having their scar treated, it's usually a great kind of way to get them used to it. And just do it until you feel some good circulation in there, feel some softening. Usually you'll see the area get pink. And that's a great kind of beginning treatment for scars.
Thank you. I'd like to share a story from Mr. Yanagishita Sensei, one of our teachers in Japan who passed away a couple of years ago. And he gave us a long lecture one day on how to build a practice. And we thought that we were going to get a kind of lecture on, well, you should advertise here and you should put things in the yellow pages, and that's the kind of lecture we thought we were going to get. And he kind of went through those options. He said, well, if you go to the newspapers and get coverage, you might get a little boost in your patient numbers for a few weeks. And if you advertise in the yellow pages, you might get 1 or 2 calls every month. But the best way to build your practice is to practice your needle technique. In fact, what he said specifically was to work on your oshide, your left hand. He said if you do that, you'll start to get better results. And if you get better results, then your patients will go and sing your praises. And that's the best way to build a practice. And it was a very kind of spiritual way of thinking how to build your business. But I think we can draw from that having the facility to treat scars is also a way to really build your practice. Because if you have, first of all, the ability to recognize that scars need treating and that they have secondary effects, and secondly, you've developed the skill set in which to treat those things, then your patients will go and sing your praises. Because they might come for knee pain, but if you treat the cesarean scar and it was purple and horrible, and a few weeks later it's gone, or just flat and flushed and pale, they will really sing your praises.
Mm-hmm.
Yeah. Is there any...
That's true.
Go ahead, Phil.
Yes, that's very, very true. I think to be recognised by your patients and get them to sing your praises, you have to be passionate about getting great results. So I was there with you when Yanagishita Sensei provided us with that great lecture, and it certainly holds true for them to tell others, and it does work.
I'd like to ask a few more questions. Going back to equipment, are there any particular kinds of needles that we should be using? Virginia, I think you had something to say about that.
I think good quality needles is a must in any kind of acupuncture, and the less pain that we can produce upon insertion, the better off for our patients and our practices, because the patients don't know if you've memorized the classics in Chinese or Japanese. They just know this person hurts and that person doesn't. And there was some research presented at the Society for Acupuncture Research Conference. I think it was 2003 perhaps, or 2004, at Harvard, about using functional MRI imaging of the brain, what happened when person had the Da Qi sensation, when there was a painful insertion, versus just, I think they just needled stomach 36 in both cases, doing it without any pain and without manipulation, and the people got more of an endorphin response and more of a healing response in the brain when there was no pain associated with it. So I think, you know, having very fine gauge needles, and you might want something like Siren with a silicone coating, because that's a lot less painful. Also, there's something that's on the Acupuncture and Medicine Journal website. It's aim.bmj. I think .com or .co. Anyway, they have a 2014 article about the differences in needles under a microscope, magnified under a microscope, and some of it's pretty shocking. But also at that research Society for Acupuncture Research Conference years ago at Harvard, there was a poster presentation by a university in Korea about needle coatings. And they said that the expensive Japanese needles with the silicone coating, they wouldn't mention names, just 0.5% of the needles have the coating come off under the, when viewed under the microscope. whereas the inexpensive Chinese and Korean needles, up to 88% of them had the coating come off. And now there's, on this Acupuncture and Medicine website, an audio recording of from Mike Cummings about this findings about, you know, the quality of needles, and with some of them there's shards that are coming off of the needle and staying in the body. Not that this is probably a common occurrence, but with cheap needles this is, you know, quite possible. So another reason. And for scars, you know, getting back to that, it's really important not to, you know, give them any extra inflammation or irritation in the area or any other extra risk for infection as well.
So what you're saying is to use fine, thin, Japanese high-quality needles for the treatment of scars, rather than some of the thicker or inferior quality needles.
Right.
Is there any research, Grace, or is it, if someone wanted to read about treating scars, are there any books or are there any papers that we could read about the acupuncture treatment of scars?
Sure. Well, there's a pretty good chapter in Kiko Matsumoto's Clinical Strategies, Volume 1, which you can, if you don't have it, you can get by way of her website, kikomatsumoto.com. And also in the November 1995 issue of NAJOM, the North American Journal of Oriental Medicine, November 1995. That was her article on treatment of scars that was first published in a Japanese journal. And I think that Philip, you've had an article in NAJOM since then. Was it you?
It was I. It was November 2012, was it? I can't remember exactly, but that was when I first published an article. Yes.
Yeah, and NAJOM, you can get back issues.
Your article on treatment of scars in NAJOM is your techniques using a Taishin. Is that correct?
It is correct. I've also published recently in the Swiss magazine and the Irish magazine. The Irish one came out late last year. I also came asked to present in the Rothenburg TCN Congress next year. So 2 workshops already organised for that.
Okay, everyone.
Can I say something about needling?
Paul, you go ahead.
Yeah. Well, just a couple of points about needling, if we're going to needle scars, that are relevant for people who, as you say, haven't attended a workshop, are there and you know, can use needles in their clinic. A couple of principles which are really, I think, basic to follow. If you're not going to be doing the typical bridging of the scar where you're needling towards the scar at each end, then work with following the scar, and which is in the meridian flow. If the scar is radiating sensation on palpation, you should needle in the direction of the radiation. Also, when you do needle, you should stop where you feel the resistance and wait 2 or 3 minutes until that resistance lessens before you try to needle any deeper. But ultimately, as everyone has said, you want to stay quite shallow, and probably lastly, yes, using a very low angle. Don't needle perpendicular, because most people who have trained outside of TCM will needle everything perpendicular. They don't understand that oblique needling method. So needling in an oblique method, probably 10-degree angle, if not even less. But and again, as everyone has said, the more shallow the needle, the better. I think that would help anyone who hasn't done a workshop.
Thanks very much. Well, everyone, we're coming to the end of the show. I'd like to chat just before we finish a little bit about Sayoshi TV and Sayoshi.com, which is and what we hope to do. So basically, we are going to aim to help practitioners and students of Japanese acupuncture to raise their profiles and to brand and build their practices and increase their knowledge and skills. With so many styles of Japanese acupuncture being practiced outside Japan, Sayoshi.com is going to be a forum and a hub for all styles and all schools to grow and flourish. And we hope to help the public to learn more about the uses and benefits of Japanese acupuncture and palpation-based acupuncture. And we hope to help them find practitioners who are guided and influenced by this ethos. So, yeah, I'd like to thank you all very much for appearing on our very first Sayoshi TV show. It's been great. And thank you very much all for coming. And thank you all for watching.
Thank you, Oran.
Thank you. Thank you, everyone.
Thank you, Oran. A job well done.
Thanks. Goodbye.
Goodbye.
Bye-bye.